Welcome to the show, Brain Health Unchaining Your Pain, and I am so excited because I have the just amazing friend, wonderful Louise Carmi on the show today. Louise, welcome.
Thank you. Pleasure to be here.
Now, for those that don't know Louise, she started work as a nurse in the UK National Health Service from 1964 to 2006. Ending her career as a senior service manager and children's safeguarding specialist. She was then introduced to havening by Paul McKenna in 2013 and became one of the first trainers worldwide. She was based in London, although you're not there anymore, but part of the London practice, and starting the first practice group worldwide, introducing havening to Australia. And she's continued to benefit from and continues to promote this extraordinary technique since then. But we're going to really talk about your several health obstacles in the context of brain health during your life. So I'm really excited to dive into that from a brain health perspective. But Louise, before we start, I know we've been like friends, not actually for that long, to be fair, maybe a year and a half. Or something probably, like that. But Louise is always like my go-to person when I want to sort of vent frustrations that I'm having. And she really understands me from a sort of my passion perspective. So I'd love to hear what you're really passionate about now that you really love doing.
What am I passionate about? I am an Aries, so I'm quite a fiery, allegedly, quite a fiery person.
Yes, you are.
So I have to be careful not to consume people sometimes. What am I passionate about? I guess my life has been taken over by the work that both me, my husband, and my daughter have been doing since 2013 with havening, and the difference it makes to people's lives is I have to say, it's probably slightly addictive if we're talking about brain health, because, you know, we see the difference it makes, and doing the stuff that we've done together and with the group of people that we've, you know, been supporting and being supported by is very, very gripping. So that is a huge passion. And I have to be careful with family now, because I can see their faces when people say, "Oh, hello, what do you do?" and I can see their faces going, "Oh no."
Well, I love that you mentioned havening, because that was the real catalyst for this show. That I first experienced havening with Tony Burgess, who really helped me deal with the trauma of losing my dad back in 2019. Gosh, can't remember. It feels such a long time ago, and it was really difficult for me, and it really changed my life. And I just thought, you know, this show is about helping people do exactly what havening does, is helping people unchain their pain and giving them different modalities and tools and techniques and stories in the context of brain health, so that they can really learn about their brain, learn from other people, because we love storytelling, don't we? Learn from other people's experiences and hopefully give them some hope and some guidance, really, to help them really optimize their brain health and then unchain any pain that they're having.
Another little story just sprung to mind is that I've spent the last week in Oldham with my sister, who had severe brain damage following a vaccine. She had smallpox vaccinal encephalitis in 1954. And I remember seeing her in hospital with a really curved backward spine, the epistotenus, where it's like C-shaped backwards. And Hillary's just had to have a total knee replacement. Her gait was very distorted and she was in a lot of pain. And she's had really good, successful surgery. And when I went there, the physios came in to see her and commented how well she was doing. And she said, "I've been doing this havening thing that my sister taught me." And I say, calm, painless, calm, painless. So Hillary, with a very limited intellectual capacity, was actually showing the physiotherapists what we did for her pre-surgery, which reduced her anxiety and I think helped maintain her state. And I think that reduced her pain post-op.
Yeah. Do you know, I think it's so important, you know, for those that don't know what, I think it's probably worth sharing what havening is just quickly for those that don't know, the listeners, is it is a psychosensory technique that uses the power of human touch to help us generate calming delta waves in our brain. And it was first sort of discovered by Dr. Ron Rudin and Dr. Stephen Rudin as they were exploring the best modality to help people get relief from trauma or PTSD and anxiety. And they started with looking at tapping and stumbled across the fact that we can use human touch in a stroking way that we all inherit from birth, is this ability to calm ourselves and emotionally regulate ourselves through the power of human touch and, you know, giving each other a hug. And really it's been developed since then to help people generate these lovely calming delta waves in their mind. And by doing so, what happens is when you have a trauma, you bring the trauma to the front of your mind without having to say anything. And by generating these lovely calming delta waves through the power of human touch, you are able to depotentiate or reduce the receptors that we have in our brain that are put on the surface of our brain cell as a result of the trauma. But the calming delta waves literally unplug them and send them back into the brain cell. And that gets rid of any outflows, any remote emotional response, any physical response, somatosensory responses that we have, and autonomic responses as a result of any trauma that we have encoding. And I will put a link to how people can find out more about it in the show notes. And it's just phenomenal, isn't it?
Well, I say for me it's life-changing, and certainly our experience in working with people is incredibly life-changing, and much more speedily than you could imagine.
Yeah, and it's 50 minutes of freedom, isn't it? Sort of
and absolutely. And the in terms of the delta state creation, one of our Haveners trainers in America worked with a firm in Brisbane in Australia, and she asked the chap who developed this brain wave technology to put delta on, so we can actually see in real time on your phone how quickly delta state is created just by doing this, and then how quickly when you stop doing this it goes down. Really fascinating. That who'd have thought it?
I know. And do you know what I love about it? I love the fact that everybody at any age can learn it. And, you know, the fact that my daughter Lily was able to learn it at 18 months and I've used it. She's used it to help calm herself down, you know, when needing the toilet. You know, and she loves to have it at night time. If she needs it, she'll ask for it. Mummy, can you stroke my face? You know, and she just loves doing it, and it's something that everybody can learn and everybody can apply for day-to-day needs.
You've reminded me of another little story, which is in one of the first havening trainings I did, but it's probably April 2015, something like that. There was a nurse who was one of the participants working in a severe brain injury long stay unit, and a couple of weeks after the training that we did, she rang me and she said, "I've just got to tell you something." And I'm like, "Okay, yeah." Always really interested to hear stories. And she said that there'd been a young girl who'd had a severe road traffic accident, had been on the unit for a couple of years and was inconsolable, screaming, not relieved by painkillers. And what she did when she'd done the training, she went back to her unit and did this with the girl. And the girl stopped screaming. She'd not spoken since admission, opened her eyes and said, "Mum." And that was the first thing. So that's why that's why, so at that time I can remember feeling, wow, that is quite emotional. And she was so overwhelmed by that response, that very quick calming response in this really severe injury unit, that she felt that she had to phone me and,
Yeah. So, yeah. And it's almost like miracles happen, isn't it, every day with Havening, because people can't, often the clients that I help can't believe that the change can happen so quickly in such a short space of time, and they can't comprehend the cognitive shift, the emotional shift that happens, and the pain shift. And my mum, she has chronic back pain, and she's due, she needs to go for surgery. But when we were getting ready to go in to see the specialist, she was really anxious about it, and her back was very sore, and we often use Havening to help reduce the emotional load that is in her mind, that is amplifying the physical pain, and calm it down. And we can often bring it down quite quickly for her, and her pain levels significantly reduced. So I think it's an incredible tool for so many different reasons, from helping people with PTSD, as I've done, all the way through to chronic pain, major trauma. And I don't think we, from a brain health perspective, people, when I say brain health, people often think of mental health, but it's such a much broader topic than that. Mental health is only a tiny subset of brain health. And it's so important that we equip people with tools that help their brains get better, whatever the root cause of the problem is, whether that, like you said, is major trauma from a car accident. And I know you've got some phenomenal stories yourself in the context of brain health, and I really want to dive into that, because you've got some great ones. But before we do, in the context of your life story, what for you would you say is optimal brain health?
I guess, and I know there's no right or wrong in this, but I guess for me, it's about feeling healthy, being present, having capacity to do things that I normally do and need to do, and having a life that's rich and fulfilling, or having the capacity to have a life that's rich and fulfilling, which I'm very fortunate to have.
Yeah.
I mean,
I think that's lovely. And I always like to think of the 4 quadrants of brain health, and you've really touched on all of them. Is that emotional well-being, that it's important that we feel emotionally secure, the physical well-being aspect of being able to do what we want to do, the mental well-being, which is having that cognitive, that clarity and that need, and also spiritual well-being, which very few people talk about, is being able to live a life with passion and purpose, and feeling fulfilled at that level as well. So I'd love to dive into your story, and I know it starts at I'd love to start at the very beginning, because I really relate to this first part of your story, and I think many people have experienced something similar to what you have.
You have to be careful that I don't burst into the sound of music. Let's start at the very beginning.
As Winnie the Pooh said, it's a very good place to start.
Yeah. I was born in April 1947. Worst winter on record. It was snowing. My mum got stuck in a snowdrift and fell off a bus. And I was what my granny used to call, she said, I was knocked off the shelf. I was born 2 months early.
Wow.
And weighed 3 pounds 4 ounces. So I was in special care facility, and at that point was given oxygen, because they just started using it for preemie babies, and so clearly survived. But I had this story of not expected to live. My mum was a midwife at the time, and it's like, you don't expect to rear that, do you? Because I looked like a monkey, and my ears had to be stuck. This is stories. My ears had to be stuck back with sellotape Yeah. So
do you know my dad? I really want to interject here because you just hit so many levels for me.
yeah.
My dad was born early too. I think he was 2 pounds, and I can't remember what his weight was. He was born in 1940, also April, very premature, but he wasn't put in an oxygen tent.
Yeah.
But interestingly, and that possibly saved him from what I know you're going to talk about shortly. But interestingly, he also had to have his ears pinned back because his ears are out like this. So that's really. No, I never really thought that was. I just thought it was my dad, but obviously, maybe it's a premature thing. I don't know. I
won't say what my cousins used to call me, but it meant that I would not. I mean, now look, I've got ears. That's fine.
Yeah, my dad had to have them like plastered back. I think his mum used plasters to hold them back.
Yeah, but I did not have a short haircut until I was over 30. Wow. On the basis of the names my cousins used to call me when I was a kid, about my ears. But there you go. So so I survived, obviously, and did well. I had, from this, I had in the late 70s, I had vision loss. I lost my vision a few times because I had retinopathy of prematurity. So I was in and out of hospital having major eye surgery. But in that, at that time, I was working full-time in the NHS, but I was also, in my spare time and holidays, monitoring development programs in West Africa, which were, at that time, really interesting because they were one of the first income-generating small-scale enterprise development programs. So I had this passion for not only doing my full-time job, but also being a mom, looking after the family, but nipping over to Africa to do the monitoring. And I was really worried when I lost my vision that I would be impaired and prevented, life would prevent me from doing that. But the consultant that I had at that time was called David McLeod at Moorfields, just said, Louise, you just go and do what you need to do and I'll sort you out if you need sorting out. And that was the biggest gift that he could have given me. So it enabled me to, to continue doing the work that I was doing there. I'm looking at my list of things that have gone wrong with me, but I also, so I was working in the community as a district nurse, child protection specialist, health visitor, cot desk specialist. And I had a whiplash in 1984. I was shunted about between 12 and 15 feet up the road when I was parked.
Were you hit by a vehicle behind, was it?
I was parked the side of the road.
Yeah.
And a vehicle I don't know why it didn't see me, but it shunted me about between 12 and 15 feet up the road and had a whiplash. I just come out of hospital and with my vision repair, and one of the doctors said, don't bang your head or else you'll go blind. Be careful of the messages you give people. I didn't go blind, but I did lose my dominant left arm. I had I was off work for nearly 6 months because I literally lost the use of my arm. I couldn't drive and I couldn't lift the babies that I was working with. So,
did anybody consider that you had any head trauma at the time, or was it dismissed by just being pure whiplash?
My husband was a doctor. He is. I was a nurse. It was like, okay, you can go home now. You can you're all right. So I mean, I can remember those days you had these big collars on, and I can remember they put one on and then they took it off again, and I nearly fell off the bench because it just felt as if my head was so unstable. And that took a while to recover.
Now, I think it's really important to note here is that, like, a lot of people have head trauma who come to me or to specialists I refer them on to, that goes undiagnosed, and it's often a result of falls or car accidents. And what can happen is your brain, and I'm just going to try and bring this screen. So your brain is housed in a skull, and this is let me bring it over to the center. This is your brain in a skull. So I'll take the lid off. And when we have a trauma like being in a car, obviously your head goes backwards and forwards, but you can see the brain actually rattles inside the skull because it's just very soft. It's consistency of butter inside the skull. And inside there, you can see that there's lots of sharp bony ridges. And one of those sharp bony ridges also is the entrance into the skull, which is where your cerebral spinal fluid flows. And that's important for limb function. And if you have a whiplash injury, there's a high likelihood that you could displace your brain inside its skull. So you could have problems with the cerebral spinal fluid flow into your skull itself, and also cause problems with your pituitary gland and your hormonal regulation and things like that. But often what we also see is people that have brain injuries that go or falls, knocks or falls, have what we call as there's displacement of the vertebrae, the top two vertebrae at the top of your spine, and they're very delicate and very easily displaced. And those vertebrae help, if they're displaced, then they can block the flow of the cerebral spinal fluid that circulates from your brain all the way through your body. And I've had clients who have had problems with limb function that's gone undiagnosed as a result of having falls, and problems with neck pain and all sorts of things. And actually the fix is very simple, is to go and see an atlas orthogonal specialist to make sure that those vertebrae in the back of your neck are appropriately aligned, so that your cerebral spinal fluid flow moves properly, and allows you to have the function that you need throughout the rest of your body. So we mustn't forget, if we do have limb loss issues as a result of a fall or a car crash or anything, is to think about how is that being affected by displacement of the vertebrae in the back of your neck. And you could obviously have cognitive problems as well, including migraines and depression. There's all sorts of different cognitive issues that can arise as a result of the disruption to that fluid flow. Did anybody mention that to you as not often picked up?
Yes. No. Yeah. Well, I did. I've had ongoing neck issues. I mean, not significant, not excruciating, but I've had ongoing neck issues since then. And I certainly in my last, between the 50s and 60s, used to get huge amounts of migraine, and that would be tying into this 84, a lot of migraines.
So that's quite possibly as a result of disruption. I can't say for certain, but it could be.
No,
definitely worth getting it checked out.
Yeah, oh, that's helpful.
Yeah.
So should we go on to the next bit?
No. So let me just go back on this just to finish off the conversation that we were having. Is that this procedure is very gentle. So if we have kids who come in who have these problems, it's a very gentle procedure to get it resolved. It's just gentle manipulation at the back of the neck. So for anybody who's like thinking, oh my God, I'm going to have to go under the knife, or it's going to be a major problem, it is not. It's a very gentle manipulation. You get to lie down and chill out and get it resolved, and the results can be absolutely dramatic once you've restored that function. So if anybody's got any, we'll put some links at the end if people want to talk to me about it.
That's interesting.
So after that, you managed to get your movement of your limbs back, didn't you? Of your left arm.
It took about, it's my dominant arm, and it's amazing how just the simple thing of not being able to brush your teeth with the arm that you used to brushing your teeth with is, it impacts. But it took about 6 months.
Wow.
It took about 6 months to get.
And how did you manage to get yourself better in that context? I know you said you're very determined, and
I basically I have such a strong get on with it. I'm sure it's partly from my Manchester, my northern roots, where you just keep going.
And also carry on.
Actually, from my family history, from my grandma, mama, who just kept going. Whatever life threw at them, they overcame it and provided for family and worked hard all their lives. So that's an injunction that that I have.
So you won't let it defeat you, basically.
No, and also I couldn't imagine not working. So not going back to work, it wasn't an option. It's about purpose, isn't it? Your purpose in life. And I've always had a very strong sense of purpose in terms of helping people and and actually fighting for justice as well. It's always I've got this justice gene where I've just got to keep going and do my job. Yeah.
Do you know, I think that's really beautiful that you talk about that, because you mentioned earlier that the surgeon who helped fix your eyes just said, don't worry, I'll help you. You will be able to go and fulfill your purpose. And that was so powerful for you. And I don't think we pay enough attention to the importance. You talked about language earlier on as well. Is the importance of the language we use when we're helping our clients or we're helping patients in the context of, medical professionals, that what you say to people and what hope you give people in the context of those 4 quadrants I spoke about at the beginning, emotional, physical, mental and spiritual, was really important. Because everybody works differently. So some people might feel an emotional need, but for you, that spiritual, that sense of purpose, that spiritual health piece was just so fundamental to you. And that's what really sounds like has been your kind of driver to help you, recover all the other aspects of health.
And the difference in the consultant that said, you just go do what you need to do and I'll sort you out, to the doctor as I was leaving the ward saying, don't bang your head, don't lift heavy objects, don't bang your head or else you might go blind. And then within a couple of weeks, having the whiplash. And a passing policeman just knocked on my window and said, "Madam, what have you done?" And I said, "I was parked here. I'd not done anything, but would you mind getting an ambulance because I might go blind?" But he didn't understand why I was saying that. But and I didn't realise at that point I hadn't, my arm had been knocked off. But the difference between those 2 messages are worlds apart.
Yeah.
Fortunately, I didn't really take much notice of the latter one, but
but some people do, and that really affects them emotionally, doesn't it? And that's the power of havening and other techniques to help re-establish that sense of purpose and take away the emotional charge that someone has said. What someone has said to you can really trigger trauma, even if you think it's small at the time.
Absolutely.
Yeah. And so after that, so you went through a period of recovery. You focused on getting back to work, so your spiritual purpose was still being fulfilled, or you're working towards that. And then life took a big turn for you again, didn't it?
Yes. I had a minor deviation when I had salivary gland surgery and lost, had facial paralysis for about 3 months, but that sorted itself out. And then in March 2011, I had really strange symptoms. Just, I don't know what you say, if it's the right word, just slavering, we call it up north here, just having saliva. And I can't understand why I was having it. So I went to a routine check with my GP, and Mike, my husband, came with me, and he said, tell her about this. And I'm like, oh, it's fine. But she listened. She said, it's odd. I want you to have a brain scan. So I went to one of the prestigious London hospitals, North London hospitals, and I had a brain scan and was given an appointment afterwards for 6 months return. So I thought,
what type of brain scan did you have at the time? Was it MRI?
I had an MRI with contrast.
Okay.
And I was just sent an outpatient's appointment for 6 months. So I thought, oh, that's okay. You know, I wondered whether they wondered whether I'd had a TIA, so that I think a transient ischemic attack. So they'd sent me, I think, to a TIA clinic 6 months later.
And just describe to people, the listeners that don't know, what a transient ischemic attack is.
Well, that's when you have a mini, tiny stroke effect that limits maybe partially for a short period of time and is transient, is recovered from. So I didn't think anything else about it, and in June, so a few months later, I got an appointment, and the surgeon asked me to go back the next week, or the hospital, and I couldn't. I'd arranged to go on holiday, so I rang and said, "I'm sorry, I'm away." And then I got a phone call back from one of the registrars saying, "You do know you've got a brain tumour, don't you?" And I'm like, "No, I don't." And that's exactly what she said. And I think it shocked. Yeah, it shocked me. I was sat at the table with my daughter and my son, my daughter and my husband. So I went back and had another outpatient's appointment, and the treatment wasn't. It was rather dismissive. So I then relocated to the National Hospital in Queen Square, and by the time I'd gone through the system there, which is excellent, I'd got a big meningioma which crossed both sides of my head here. So I went in and had surgery in August 2011.
Wow.
And very positively lost a bit of weight beforehand, did some exercises, doing well. And then when I woke up from anaesthetic, I had lost the use of my left leg. And if anybody would like to know what a dead leg feels like, it is huge and heavy. And the consultant came and said, "Oh, I'm sorry, your leg's not working." And she didn't say at the moment, but she just said, "I'm sorry, your leg's not working." And I just said, "It'll come back. It'll come back." And that was whilst I was still in the recovery. The next day, I'm left-handed, as you know. I was trying to eat soup, and I couldn't make it. So I'd lost, power. I'd lost the use of my left arm. So I was transferred to to one of the recovery units and spent a couple of months. About 6 weeks, I think I was there.
Wow.
Fantastic care. But the whole time I was like, I have goals. This is what I need to do.
That's your spiritual sense of purpose.
Yeah, and I'd taken into hospital with me Paul McKenna's, I think, a Walkman with Paul McKenna's "I Can Make You Sleep" on it. So basically, I plugged Paul McKenna in, listened to his amazing voice, slept a lot in between having not great hospital food, but also so recognize that I needed to restore, recover, and then cope with the pain that I had post-op, which actually had morphine for a while.
Wow.
But I can't remember how long now, because it is a long time ago, but I really over a short period of time recovered sufficiently to sit out of bed, and then I was discharged home. I think it was October, but I'd set myself some goals, and the first one, this might sound a bit rude, was to be able to pull my knickers up. I
think that's a great goal.
Go to the toilet by myself and pull my pants up, and the next was to be able to make a cup of tea.
I mean, these are all really dexterous, functional things that we that require use of both limbs, isn't it? And
to be able to get home, and
right.
was 22 stairs up to the apartment that we lived in. So I knew that I had to really function to be able to be home. And then we have a place in Italy, so I'd set a goal for the spring so that I could visualize myself, which I did, the pathway from the car park to our place, which is really overlooking the mountains, which is amazing. So doing that visualization of that pathway, thinking about the pizza parlor, the little restaurants, and getting up to the, to our place was a really strong incentive in terms of recovery.
Yeah, I love.
Sorry,
I was going to say I love that, because I think, we can often easily devalue the importance of setting ourselves goals that will help us on our journey to recovery. And sometimes that journey can feel so big that it's hard to sort of break it down into bite-sized chunks. But I love the fact that you were able to do that in terms of, yes, they were stretch goals, but something that you could tangibly work towards. And then once you've achieved that, you work towards the next one. And I also love the fact that you mentioned visualization, because it's such an important tool in terms of helping educate our brain to tell it that it can get there by getting there in our mind. And our brain can't differentiate easily reality versus fantasy. So by doing that fantasy work and that visual work, and we know athletes, a lot of athletes do this as well, it's such an important tool, is that visualization of you getting to your apartment in Italy. And doing the steps is so important.
And it's not an easy climb. Actually, it gets easier once you've been there a couple of days. You acclimatise to it. But I was there in my mind, and actually, it was the thought of not being able to get there. It was like, I can't not go there. This is it. I have to do that, because this is such a special.
It's necessary for you.
It is.
Yeah. Go on, carry on.
No, I'm just trying to think. I guess this was pre-Havening, of course, because it only happened a short while, a year or so afterwards. But the other thing that I did was, one of my dear friends who passed recently with a malignant brain tumour, invited me to the Lake District that December. And
love the Lake District.
I did my first walk outside in between Christmas and New Year, on the side of Lake Windermere. And
lovely.
She'd been inviting me for years, and she'd said, she came to see me in hospital a lot, and she was saying, we want you to come at Christmas to the lakes, and again that that sense of purpose of doing that, not letting people down, doing it, but also being in nature and enjoying that sense of freedom and the escape of being in nature as opposed to being in London.
I find it so healing, and I love the Lake District, and I can really relate to Windermere, because when I took my parents to Windermere, they'd never been, back in 2008, I think it was. And we took them up Tog Crag, which is the Loughrig Fell, which is at the north end of Lake Windermere, overlooking the lake. And it may be you walked up that hill, I don't know, but it was an easy, manageable hill for people with limited mobility, and that was actually the first hill we took Lily up, as well as a little top. So I really relate to that place. If no one's been, Lake District is absolutely beautiful, and connecting with nature so important. I'd love to know, when you were going through that recovery piece, you mentioned that Paul McKenna's video tapes that you listened to on restorative sleep. What was the real key? What do you think was that real shift for you in terms of that recovery journey that you went on?
I think allowing myself to have time to restore. So, the sleep was a good bit of it. And feeling, well, as soon as I could sit out of bed, the physios bought me a static, like a bike that didn't go anywhere. You know, you just had pedals.
Mm-hmm.
And I strapped myself on it, and with my good leg, you know, trained the one that wasn't working at that time.
Wow.
So I did that, not overdid it because it would have been fruitless, but I actually did it fairly religiously, you know, because I think I've got to retrain. I've just got to retrain the bits that aren't working so well and get them going. So
yeah.
And I mean, the other, of course, is the love and support of family. And I can still see I had an unexpected visit from my son and grandsons who were very little. And I can just see, I was in my bed and they walked in the ward, and it, you know, it's like another sense of purpose, you know.
Yeah. Oh, that's lovely. And you know, I think that giving ourselves permission to allow our bodies to do the healing process in its own time, yes, having that sense of passion and purpose to help it, but sometimes I think we feel that we can just go back to normal very quickly, and we don't give our bodies enough time to do the healing that it needs to do. And sleep is such a powerful restorative function. And you know, there's been so many studies on the importance of sleep. I'd say it's the most important thing that we need to do in terms of optimizing our brain health, and it's actually one of the 11 risk factors associated with cognitive declines. If we don't take that time to do the sleep that we really need to do, we actually you know, don't do ourselves any favors. Our brain washes itself at night time. It clears out all the rubbish or the trash, if you're listening in the States, and make sure that we are rebooted, you know, refreshed and rebooted, ready for the next day. And we know from studies that we're sleeping so much less nowadays than we used to back in the early 1900s, up to 40% less than we used to. And that can have a huge impact. So sleep, I know for me, every time I get sick, that's the first thing that I dial in on, is giving myself permission to just recover and rest.
And you mentioned brain health, and 10, was it 10 or 11?
So there's 11 risk factors, and sleep is one of them. Yeah. So I don't think we're going to have time here, but blood flow is another one. That's the number one predictor of Alzheimer's disease from a brain imaging perspective. So if you have reduced blood flow into your brain for whatever reason, and if, you know, from the situation that we're in now, which is COVID, it's believed that often some of the brain health issues that we're experiencing is a result of reduced blood flow and reduced oxygenated blood to the brain. And so it's really important that we take the time to focus on optimizing our blood flow. And obviously you doing that exercise on the bike would have really helped get that blood flow and all the neurotransmitters that are essential for your brain function back into your brain, and avoid the things that hurt it. So caffeine restricts blood flow to the brain, as well as alcohol. And it's just really vital that we take the steps that help our brain and avoid the steps that really hurt it. So
I guess one of the other things that I need to say is that I still have a little visitor here. I have another meningioma, tiny one in the faults at the back of my brain, which is in the cleft in the middle at the back. So it's quite a difficult to access area. And I've been under review now for 10 years. And 3 years ago, I went to my outpatients appointment to see my wonderful consultant at Queen Square, the National Hospital, Queen Square. And she'd already, before the outpatients appointment, had been discussing with the team about having cyber knife, like gamma knife surgery to this little visitor here. But when I turned up and I could, you know, I was standing on one leg, I was demonstrating how fantastic. I could balance in the outpatients. And she said, actually, there's nothing wrong with you, really, is there? So she just said, we don't need to do anything. We just keep an eye on it. You are so amazingly well. Just keep doing whatever it is you're doing.
Yeah.
And I had my last discussion with her last week. I had another MRI with, an MRI with what you call media, where you can.
Functional MRI?
Yeah, functional MRI, yeah. Last week, and she just said there's no change in the last 3 years. So
that's amazing.
Whatever you're doing, just keep doing it. And I think one of the things that I have been purposely doing is when I've been doing hands-on with clients with the evening, is actually I am giving myself a message. So I am saying, I'm saying to myself as I'm doing it, I'm healing, but I'm also putting hands on, and there's a lot of biblical stuff about hands on, isn't there? But putting hands on and passing healing messages, and I'm sure there is some exchange of energy, especially during the face-to-face hands-on, that has enabled me to heal myself as much as, or maintain my state, as much as supporting the healing of other people who are also able to, do a lot for themselves too.
Yeah. And I think that's a really powerful message as well, because, I don't think we should ever underestimate the power of human touch and the power of the mind in terms of what we can physically do for ourselves to heal ourselves. I can't remember if I mentioned it earlier, is that we talked about Dr. Gabor Maté in his book, When the Body Says No. It is that we actually all possess the power within ourselves, which we can really access beautifully with havening, to give ourselves that permission to heal, and to allow ourselves, like what you said, is allowing ourselves to reduce the trauma, any unhelpful responses that we have in our mind that is not serving us, is to calm our mind down. And we've seen some phenomenal results from a brain imaging perspective on the application of havening. It is to be able to calm our mind down, and then that gives our body permission to heal, because it's not in fight or flight with how our brain's working. It's actually working in harmony with our brain function, or our brain's working in harmony with our body, and our immune system is able to do what it needs to do, and use, fight the battle that needs to be fought without us fighting ourselves.
Yeah. I mean, I also do self-havening for myself as well.
Yeah.
So the morning and evening, giving myself good healing messages or hopeful whatever.
Yeah.
Sometimes dealing with stuff that comes up in the day that is, maybe a bit overwhelming. So
yeah, and it's powerful stuff. And this isn't hocus pocus. Some people may be thinking, oh my goodness, well, they're talking hocus pocus, but it really isn't, because you've been involved in a study with Kirsty Hodgson and co-workers, where you've demonstrated with a very well controlled study the power of havening with a control group, looking at a control group. And I know that we've seen that the those that were in the control group with type D personality still had it after the activity, and those who received havening no longer had the attributes of the type D personality, and that was just within 1 hour of receiving havening. So it just goes to demonstrate how powerful it is. And it's, for those listening, you might not be into that. It's not the only approach that you can use. The key thing is to activate your parasympathetic nervous system, so that you're not in the fight or flight response state, and that you're allowing your body to get into a healing state, and that allows you to then use the power of your mind to heal yourself. And I just want to give an example of the power of our mind. So I was listening to Dr. Dr. Daniel Amen, they're talking about, he watched a video of a woman in India, I believe, who was able to, through the power of her thought, was able to control blood flow in her hand. So they made, I think they did a syringe, or she had a puncher in her hand for whatever reason, and she was able to regulate the blood flow. And I thought, well, I'll give this a go myself. And when I went in to have Lily, and it was a pretty traumatic experience, normally I go into complete freeze state when it comes to injections. And I thought, well, you know, I'm just going to focus my attention on my blood, and I'm going to tell my blood where I want it to go, which was to the site they were going to put the needle in. And I focused all of my attention on that. And the nurse that did the injection to put the cannula in, not cannula, whatever it's called. Yes, cannula.
Cannula, yeah.
Okay. I got the word wrong the other time and called it catheter. That's not the right one. So the cannula in, my blood shot across the room as if it was an artery. And she said she'd never seen anything like it. And that just goes to show, you know, the power of the human mind. If we put our mind to things, and you've very much demonstrated this in your focus on your spiritual well-being and your sense of passion and purpose, and saying, I can do this, it is how we can really accomplish things that perhaps you know, traditional medicine or traditional techniques might think aren't possible.
Absolutely.
Yeah.
And we've, you know, in working with the people that we work with, we've got, you know, huge amounts of well, it's anecdotal, it's case study evidence, but we've got huge amounts of evidence in practice about how effective we can be in changing brain state. Absolutely.
And how are you managing it now going forward with your meningioma that you still have? Are you focusing on havening? Are there any other techniques that you're doing to really help you?
Well, I mean, what I've been doing seems to be working. So, and it's mainly havening, and sometimes I might do a bit of visualization, but it's mainly havening and giving myself healing messages. I do Reiki, before havening. I did Reiki before havening, so some element of you know, energy healing. But
do you tap into the hypnotherapy at all with Paul McKenna's work?
I could do, but I haven't. I know it's amazingly effective, but no, not in this, you know, not in this context. Absolutely.
No. That's fine. And I just, you know, we all know the power of havening. The thing that I love about it is that you don't have to be with somebody to do it. So often with EMDR, you have to physically be with a specialist in order to get the benefit. But actually with havening, this is something that you can do as a day-to-day practice to really help you reduce your day-to-day stress and anxiety and get into that healing state, and even use it for, you know, when you're driving, if you feel that somebody's really annoyed you and irritated you and you need to calm yourself down before you get home or before you do something stupid whilst you're driving, havening is incredibly powerful and quick to calm yourself down by just obviously driving safely. You don't want to have any accidents. Is just to haven or stroke one arm down to your wrist, and that will help calm you down if you focus on saying some positive words like safe, peaceful, and calm.
There are other words that you sometimes use when you try.
Yeah, there might be, but you might have to release those words.
If anybody would have said to me 2 years ago that we would be able to get a significant result using telehealth for healing in the way that we know we can do, I just would have discounted it. But I think one of the side effects of COVID-19 is the fact that we've had to adapt and learn to do things differently, and it's quite astonishing to me that being in a virtual environment. I mean, we've never met, but I feel
no, we haven't.
Well, I mean, that is going to happen at some point.
At some point, yeah.
But the fact that you can do, as a practitioner, as a healer, you can direct somebody to do their own healing from across the world,
I mean, I have clients in America who I work with from a havening standpoint. So,
and you get fantastic results that you couldn't have I couldn't have imagined. But I think there is an element with the being in the same room and physically doing the hands-on that is an added bonus, but it doesn't take away from the curative aspects that we witness all the time. Absolutely.
And I know we've talked about a huge amount in terms of brain health here, from obviously the problems that you have with your vision, and that your eyes part of your brain is the only part of the brain that we actually see, from as a result of your birthing experience, or your prematurity as a baby, all the way through to major trauma from your car crash and your meningioma. For anybody that's struggling with their brain health, and please pick one that you feel you want to share the message with. What as this show's all about brain health and unchaining your pain, what one piece of advice would you give to anybody who is struggling with getting themselves back to normal, or re-establishing that sense of purpose that you so beautifully talked about at the beginning?
I guess one of the things that I recall from when after I retired, I did a consultancy with Child Protection, and I was sitting there going, this job is doing my head in. This job is doing my head in, and that was just before my diagnosis. So I would say, be careful of what you say to yourself, as much as much as you hear from other people. So the messages to self are changing. Moving forward, actually having a different outcome from maybe that you feel at the moment. I mean, that's one. But the about self-care. About self-care. Yeah.
Do you know, I'm really pleased you mentioned that, because I don't think we truly appreciate the impact that the thoughts that we tell ourselves have on our brain health, and that mental clarity and dealing with the ants, dealing with the self-talk. If we all paid a bit more attention to the self-talk that we were doing, and reframe it in a way that's so positive towards ourselves, and not listening to all the lies and all the negativity that we may be saying to ourselves, I think we as a nation will be a much healthier nation when we pay much more attention to the things we say to ourselves. So really just thank you for sharing that, because it's such an important part of our brain health, those thoughts and those words that we say.
I think that there's another that I recommend clients as well, is before going to bed, just note down 3 positive things that have happened in the day, so that you're going to sleep on something that is not doing all the churning brain stuff. I mean, even if it's a simple, I mean, sometimes I think I just had a lovely cup of tea before we started.
Yeah.
And sometimes a cup of tea hits the spots. So it could be, that was a really nice cup of tea that I had. But I mean, it can be anything. Sometimes I've had surprise phone calls where I think, oh my goodness, or feedback from a client that is unexpected. I mean, like the girl that opened her eyes and said, hello, Mom, when she'd not spoken for 2 years. Yeah. And those are gifts, those are real gifts that change your change in your biology, change your chemistry, and just recognize that life can be enhancing.
Yeah, I think that's beautiful. I mean, we will often say is, finish your day on the words, today was a great day because, and then go looking for the reasons that made your day great, and you can be super surprised with what you come up with, and it completely reframes your mind, like you say, before you go to sleep, and puts it in a back into that parasympathetic state where we're calm and we're hopeful and we're positive. And that is just so important. So important. Oh my goodness, Louise, I think we could talk for hours.
Yeah, what time is it? Oh my goodness, we have been talking.
So was fun. How can people get hold of you? What's the best way? I know we've got a banner in front.
I mean, my email, louisecarmi@gmail.com. There's not many Carmis in England at all. I think I've probably given birth to most of them. Most of them aren't me. So louisecarmi@gmail.com.
Wonderful, wonderful. Louise, it has been such an absolute pleasure and honour to have you on the show as a friend, a wonderful colleague, and just such a beautiful person in so many ways. Keep on sharing your lovely healing energy and wisdom, because it's so important in this world today.
Thank you, Ruth. That is it's been a total pleasure, absolute total pleasure. We will meet. I am going to reignite the London Pratt groups when COVID allows. So that will be a chance. We've had some fabulous meetings. So we have,
and I really look forward to it. You take care, and I look forward to connecting with you soon. And anything I can do to help you, just shout.
Thank you.
This broadcast is brought to you by WINJECT Studios. We are an all-in-one educational platform for podcasters that revolutionizes how hosts leverage content to increase engagement with listeners, downloads, and income. We come together to focus on community, collaboration, and collective impact. For more information on how you can interact directly with our hosts, access exclusive live content with offers you can't get anywhere else from our official partners, join our purpose-driven community by visiting www.winject.com. If you're ready to build a career doing what you love, then we're ready to see you there.